Hey there, Toby Stark, Stark Associates Insurance Agency. Celebrate now. Hackensack, Meridian, and Aetna have come to an agreement. So you can go to the networked hospitals. Wait a minute, go to the networked hospitals. Remember what I said about Medicare being primary. As long as the hospital system takes Medicare, which all do, it does not matter what your secondary is. Your secondary is in second position, meaning if they accept Medicare, they automatically have to accept the Medicare supplement policy. The interesting thing here is my man, Michael Diamond, reported the deal saves Aetna customers from losing easy access to Hackensack Meridian doctors. But look who he interviews. It's certainly good to have it resolved for a number of reasons, says Skip Fiore, 77 of Ocean Township in Ocean County, who had a Medicare Advantage plan. Ocean Township, well, that's not in Ocean County, but anyway, who had a Medicare Advantage plan administered by Aetna. So I've been saying it, and I hope that you appreciate it. Original Medicare doesn't have any networks. You go wherever you want across the country. You see whoever doctor you want to go see. Most accept Medicare. All hospital systems accept Medicare. So what happens is when there's a battering ram and a disagreement between the insurance carrier and the hospital asking for more money, or the insurance carrier wanting to cut rates and the hospital saying, no, we need more money, we're not coming to an agreement, we're going to let everybody know and worry everybody. That's not you. You don't have to worry. You could care less because it doesn't affect you. So you can go do what you need to do on a daily basis. Now, Skip here did have to worry because he is on a Medicare Advantage plan. And just to remind you, what is a Medicare Advantage plan? That's one of those zero premium plans that you see on TV, somebody's pointing at you to get your benefits now, and you call and they say, thank you for enrolling in a Medicare Advantage plan. You give up your right of original Medicare and go into a network managed by an insurance carrier, which means if the insurance carrier says, see ya, we're not agreeing to hospital terms, you can see ya later to your providers and you have to search for doctors. That would worry me. I would be worried about that. I'd be worried about not seeing the same doctor, the relationship that I've formed, not going to the same hospital system. And as these hospital systems get bigger and bigger, they're swallowing up all these smaller doctors, the primary cares and the specialists. So they're going to be in the system, which means that do you have to go to another hospital system? Do you want to be there? Those folks in Medicare Advantage were on basically the 1 yard line of possibly having to figure out what they're going to do for your care. That's Medicare Advantage. So we'll go down here. It talks about the contract dispute. And it says, they talk about state employees. We're pleased that they reached an agreement. Let me just see where the health insurance said the dispute got over. For example, Hackensack Meridian sent letters about the contract dispute to patients, asking them to call Aetna to voice their displeasure. The supplemental plans help pay out-of-pocket expenses for consumers who have traditional Medicare, which doesn't have restrictive networks. But the letters also were sent to customers who had Aetna for their Medicare supplement and wouldn't have been affected by the negotiations. I skipped over that for effect. That's right. You wouldn't have been affected because you picked right. When Fiore got a letter in May from Aetna about the contract fight, he called the insurer to see what would happen if the two sides didn't reach an agreement. He was told he could still see his Hackensack Meridian providers, he said, but his deductible would be $1,000 and he would need to pay 30% of the bill. That didn't sound too attractive to me, Fiore said. Meanwhile, I don't know if he's on a state plan or he's on a Medicare Advantage plan off the state plan, but I don't know how he came about purchasing it. Maybe it was the fringe benefits. Maybe it was the $0 premium. But I don't know if the heart palpitations are worth it, thinking that you may not be able to go see your doctor, or all of a sudden you have to pay $1,000. That to me doesn't make much sense. So congratulations for those folks that are back in now. The negotiations are complete. There will be no market disruption. But for most of you watching this that went down the path of original Medicare with a Medicare supplement, it didn't affect you. So enjoy. Take care.